Hello, dear colleagues. My name is Berdikhojayev, and with my assistant Berdikhojayev, we connected from Almaty National Hospital of the medical centers of the Presidential Affair Medical Center, and the patient for today, we left him from yesterday. Patient with the Cerebellar AVM, Special Martin 4-5. Patient had a previous bleeding, subarachnoid parenchymal hemorrhage from this arteriovenous malformation, and we did 2 sessions. Это третья операция, да? Не, Aslı. Bulan değil, operasyon bulan pasyenti. It's the next session, and you can see there is some collaterals from the dual branches, and it's not so significant. They're coming from the external carotid system on the left side, and then you can see the draining vein. It's a deep venous system. Sonic Berdikhojayev, headway door, Mynzhylky 6. Почта. I asked Abzal to prepare headway door, and the headway door, the Sonic 1.5 certified, headway door 156. Не было слышно? Okay. I'm so sorry. Let's do it again. My microphone was out. Yes. Let's discuss once again. This is a patient, 53 years old, patient after bleeding with cerebellar AVM, and now you can see there is a fistulated part of the AVM. It's usually last session of the treatment. Patient was coiled for the pike aneurysm, and then we did a partial embolization in this hospital, the National Hospital of the Presidential Affairs Medical Center, Republic of Kazakhstan, Almaty city, the city located in Central Asia, near the Tianshan Mountains, and this is the second session, and second or third session we did a partial embo for this Special Martin 4 AVM, and now you can see there are some dural branches also filling the AVM. And my name is Mynzhylky Berdikhojayev. My assistant is Abzal Khairatlu. And today we have a video support team, Videon company, Evgeny and Natalia. Anesthesiology team led by Dr. Aslı. My assistant is Abzal Jumabekov, and the operating nurse is Madina. Yes, it looks like deep venous drainage with the venous ectasia, venous aneurysms, and also drainage to the straight sinus and torcular region. Okay, we can go through the superior cerebellar artery, which is quite peripheral branches. The pica territory on the both sides is quite straight, going to the AVM, and also there is some ICA branches, anterior inferior cerebellar artery. It's quite tortuous, that's why I think we should go from the cerebellar artery SC on the left side, and we can occlude all this region. As the vein starts some part of here. Okay, let's take a sonic 1.535. We can place it somewhere here, and then we will place a headway duo for the control. We'll place several coils, and then we'll continue. Бірде без қай соник таштыңыз?
Аштым, бірде 35
соник аштыңыз? Бірде 25-ті ашқан салыңыз. Екі набор шпиц ашсаңыз? Екі набор шпиц. Қазір. Болады. Yes, it's very comfortable to work on weekend. Nobody is disturbing during the case, and there is no other procedures for the medical staff. Yes, it's very comfortable to do operations, but for the medical staff it's a little bit hard to work like in the working days, but it's okay. It's okay. The ideal time in between, huh? Yes. Чекай 008 headway салып. Так, қанша набор аштыңдар? Біреуді, тағы біреуін бере салыңыз, 12-ті. Даем соединение слов. As the first impression, the AVM is look like possible to treat. Contrast koyarsanız Madina. It's an eatable AVM. Step by step, it should be possible to occlude. Introducer sheath is 8 French, and then we have a ballast guiding sheath which is 90 centimeter, and we asked for headway duo 156. Okay, назад. This is a microcatheter for coiling. I think we can send it from here. Yes, the angulation on the Y connector is also influencing, has a effect on the torquing. Okay. Okay, ഞാൻ വരസം. Тоже bonus. Okay, we will go to the SCA and we need a J curve. And also we are waiting for the connection with the Paris to do the test connection. And tomorrow, 11 a.m. Astana time, we will start to stream the first case, but we will start at 9:30 Astana time. Patient with the complex AVM and has a stenosis of the carotid nearly subocclusion on the contralateral side. That's why we will start a little bit early. The stream will start on YouTube, and then at the time of connection we will switch for the link. And the second case will be at 1:30 Astana time, 10:30 Paris time. Так, бір шакал ба? Осында отырмыз ғой, да?
Не учит.
Вперед, еще раз. Назад. Смарт маск. Yes, the lateral tube is nearly kaput now. That's why the visibility is a little bit worse than it's needed. Okay. We'll go first with the Sonic. Yes, and as usual, it's going to the exact territory. It does look like there is some kind of aneurysm here. Yes, it does look like something like an aneurysm. Okay, we need to change the angulation. Okay, let's go with the headway door. We combined with the Chikai 8. As usually, it's a combination with. Okay, let's go. I will take up my ballast catheter. It's quite soft, like a Neuromax, maybe softer. That's why it's possible to use more active. Maybe something like this. Okay. There is aneurysm. The wire inside the aneurysm is SC aneurysm. Ослась назад. Осмотр мозга. Okay. We should be very, very careful and yes. First we're touching the aneurysm. Okay. Okay. Now we first the aneurysmal segment. Okay. Now it's more safer to navigate. Okay, that's in this part. Okay. Okay. Yes, now we shipped. We went around the sonic and then microcatheteries went easily. No? It's a nice technique. We learned from René, Professor Chapeau, in Essen. No? It's a nice technique. So-called shipping technique. Okay. Here is a bifurcation. Okay. Let's do angiography. One and second. Just second. Тағы да ангиографияны тартып қойшы. Предыдущий. Вперед. Вперед. Okay, stop. There is some space. We have. Yes, it's look like this. Then we can go down. Now we're quite close to the AVM. Okay, like this I think it's better. Бerdikhojayev. Let's look like this. Now we can check the angiography with the headway dual. There is a bifurcation. One branch is going at the direction of the headway dual. Yes, this direction. And that was the second one, and now we can. Yes, let's look like this. So it's like this. All branches is going to the AVM, eh? Okay, oh, need almost all. Okay, I will take it here. There are small branches to the cerebellum, huh? Okay, small branch to the cerebellum. Okay, let's take the second sonic. Second sonic is in place. Okay, let's take this. Чуть-чуть назад. Is it? Okay, this will be Sonic 1.525. That one was 1.535. This is 35, this is 25. There are a bit friction, but it's okay. It's not a problem. We don't need to go to the territory of pica. We just need to go to the SCA territory. Okay, same territory. Okay, it's touching the aneurysm. Let's do again the shipping. Yes, it's enough to place one microcatheter, then the other devices is just following the direction. Okay, there is one more branch. Okay, let's check. What's this? Was it there? Maybe it was there. Okay. I think it's something small, quite small. Okay. 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 I will ask Abzal to put a previous DSA as a smart mask. Предыдущий суперселективный. Вот. Ага, стоп. Smart mask. Okay, I think it's too tortuous, huh? Okay, now we proceed. I think this level is okay. Stop. Oh. Yes, it's okay. I think about coils we can place there. Okay, let's push a little bit the headway. Maybe one coil 1.5/4 will be okay. And for this sonic we can also push a little bit forward. Okay, let's give me the hybrid. Give it. Last one is okay. It's okay. It's okay. This one is okay. Okay, the wire is arriving. Now the both markers are in place. Назад. Do we need a coil? What do you think? So? To have coil. But I think there is enough distance to place a coil. I need to pull the whole system, but I think there is no space. Okay, let's do it without coils. We can start with fill, and then we can use surprisingly, this headway with the one marker, it looks like it's a headway 167. It's a duo, but it's 167. Headway duo certain course also? Yes, it's a 67. We could not place a coil. Okay. Fuel dash persons. We will inject fuel first. Okay, let's look. Let's look like this and look like this. Okay, just a second. There's another branch, so okay. It's a quite lateral, huh? That's okay. Okay. I think the fill we need to use through the 25. We need to increase the radiation. We'll put the glue. As we have enough distance for the 35, but for the 25 we have not enough distance. Demoso? Yeah. Любой дем соберется. Берет. Also. As now we reached the fill 25 after nearly 1 year. It was not in the department, and now we have a fill again, and it's a quite nice combination with the tantalum based and the iodine based liquid embolics. And the fill first technique we start to use before the pandemic, and I have been to Spain with the Luis Sibor professor. Наркоз поглубже, дексаметазон 1 мг. Okay, and yes, the visibility of the liquid embolic could be a little bit bad than we expected usually. Сквитване кишиневир. Мен кишинесаш? Okay. I think this is close to the vein. I think now we are close to the primary vein. Yes, after first syringe of fill, we usually ask for something more visible, and it's nice combination. Спасибо. Yes, I will start to a little bit force. На экранном курсе чеш последняя ангиография. Только эти курсы. It looks like draining vein, eh? That's a vein. Okay. Now we'll switch for the Menox. And I think the territory of second sonic also partially filled with the fill. Екіншісін жинайбыз, squid керек екіншісіне. Yes. We will start with squid 12 with the second micro. Yes, and now we reached the draining vein. It's good. Yes, now it will be more visible, and we may connect collaterals. It's very important to keep the eyes here, because it might be some branches coming from the right side, and we cannot occlude them. Так, Денисо? Так, таймер высо. Squid. Yes, this one is squid, this one is Menox. Geneva. Okay. The reflux will be quite fast in this branch. Yes, it's connecting with the pica territory. Let's check. The SC aneurysm is quite big, huh? You see?
Yeah. The frontal projection is not visible.
Okay, this is squid, and this is Menox rodent.
Nope.
Okay. This is a branch which come from yes. The reflux is reached with the squid. This is a squid syringe. Okay, and with Menox syringe we reach some part of the pica territory. I think the middle part we don't need to touch if it's possible. We need to occlude the mostly lateral. Андай болды ма? Yes, it's a collaterals, I think. Okay. Yes, now they may connect with the pica. I think it's a pica. Maybe we don't need to be so much aggressive with the pica. Oh, but it's still enough branches. Так, начнем крижесаш. Сон кресл. Now we're mixing the Menox with squid. Okay. Menox не вресна. Арастır. This is a branch we started with the fill, and as you can see there is no reflux. This might be the vein, yes? The diameter is quite big. Yeah. Okay, let's continue with this squid. Okay. I think it's refluxing, and there is another branches. This one is bigger. Huh? This one is bigger. It's going from the sea. Okay, and it's look like we okay, I will take 35 a little bit back. I don't know. Okay, this is a 25 with the fill first. As with this, we are filling this. Okay. We reached from one branch to another. Huh? Okay. Еще раз smart mask. Yes, it's again going to the okay, it's reflexing. Назад. Smart mask. Okay, let's check the angio. As there is a SCA aneurysm, and I'm not sure when we should coil it or we should leave it with less flow. Maybe it will disappear, but it's quite big. Huh? Yes, it's look like this one. Probably this one. Smart mask. Родно. Все хорошо. Okay. This is a 35. The proximal branch. It's also going to that territory. I will pull a little bit my first sonic. Okay, родно. Now we are going to the first branch with 35. Maybe. I don't know. Okay, let's inject a little bit squid. It's refluxing now. Okay, let's wait. No problem. Let's inject Rodno. I think it's a branch. It's one more branch. Yes, it's not the same territory. Okay. Мынаны кішкене бересің. Или мынаны алсың. Мынаны бересің. It's a mix of squid 12 with the Minox, eh? Жоқ, аны құя сал қайта. Скорее всего, қажет болмайды. Yes, it's refluxing. Yes, now it's refluxing. Маған пустой шприц бересің? Пустой шприц бересің? Ана, жаңа қара шприц бересің. I think we need to take out this one. Yes, now we're working nearly 15 to 20 minutes. Оп, пациент шевелится.
Пациент позвал.
Фентанил сделать?
Ладно. It's very complex to explain that we're doing the same job as a team, but it's look like I'm responsible for everything. So it's a good position, huh? You're responsible for everything. Was it 0? I think it's extravasation, huh? It looked like something strange. Суперселективный корсаж и бранч. Более проксимально. Ондай тамыр болған жоқ қой. Yes, it was not there. That's why I think it's extravasation. Okay. The first microcatheter. Now we need to take out the second one. Başka smer. Second one. Obzo. Oh, it's a draining vein. It's not bad. Назад. Yes, now the pica territory is more clear. Назад, вперед, вперед, назад. I think the next time we can go through the pica. And there is also SCA branches. Назад, назад, stop, назад, назад, назад. Arterial фаза, назад. Yes, we have these branches and I have also the aneurysm here, which is not so friendly. But I think for today is enough. We used enough material. That's okay. Назад, назад, назад. Arterial фаза. Stop. There are minimum 2 big branches and another en-passant feeders, but always going the same territory. Вперед, венозная фаза. Yes, it's going to the big vein. Yeah? Okay, let's check the aneurysm. Oh, that is the aneurysm. There is a bifurcation and then aneurysm. And another several branches going from the second one. And it's more frontal. Eh? Okay. We can deal with this next time. Yes, we see the aneurysm nicely and we can see the branches. And let's leave it for the next time. Just a second. I think you're agree with me, that's we can finish on this stage. Abzal, what is your opinion?
Can you repeat again, please?
Do you agree we should stop at this stage? Yes. Okay, let's pull the ballast. Yes, to see more clear the territory, we should go from the right side, yes, but it's not necessary. It's nicely visible, and for the next time we can go from the pica. Okay, we cut some part of the pica territory also. Okay, let's call the patient in 1 month. Control CT. Okay, let's wait for the control CT. Kaskade tutsun. Dear colleagues, now CT is ready, and this is a cast of liquid embolic, and you can see the cerebellum, and the fourth ventricle is clear. It looks like the cerebellum is also clear. And now we can finish this case, and for today it was only case, and we can finish live streaming for today. It's Sunday, and we are waiting for connection with the Paris. It will be test connection, and tomorrow morning we will start Astana time 9:30. And then 11 a.m. Astana time, which will be 8 in the morning in Paris, the live streaming for the link Paris. Okay, I hope everything will be okay with our patients, and you can enjoy the cases. Enjoy the weekend. See you. Bye bye.